Today we are going to talk on the techniques, simple techniques regarding the PFN. You know, nowadays PFNs are coming A2 also. We are not going to talk about A2. A2 device is something different. We will talk about this technique. But as such, for PFN, we are going to demonstrate practically how we are supposed to do it. Position of the patient and everything we do not need to talk. Most of the time, traction is enough to have a reduction. Most of the time, traction is enough to have a reduction. Little bit of sometimes rotation is also important. Sometimes internal, sometimes external. But what is more important? That you must have a good reduction before endeavoring for fixation. This is a must because the device is almost fixed. Once you articulate it, the device is fixed. You cannot accommodate any sort of rotation or yes. So since you have a very almost fixed device, so you must have a good reduction also. Sometimes you will find the fragment is going down below, particularly unstable type of fractures, and particularly elderly patient where muscles are very lax, under unnecessary, you will find this fragment is set down, particularly distal fragment. What we are going to do? Most of the time, the lever technique, Homan's lever techniques are very simple way to do. We do not have a Homan's here. Anyway, I am going to show a technique by which you can do a Homan's lever. Many times you will find if the lesser trochanter is intact in the proximal fragment, and there is a fracture line like this. This is almost a very unstable fracture. And elderly patient where muscles are very lax, you will find this fragment is going down below. And this is going up. Now we must have a good reduction. So you are going for minimal techniques for reduction. The technique very important is that one lever you can pass it over there, who is going to push. Another lever you can push from behind to pull up. Okay, sir? You can maintain this technique till the go for the fixation, or you can do another thing also.
Okay.
So you confirm with the reduction with the help of C-arm with the APN lateral view. Alignment is fixed. But this should to be continued until and unless you are going for fixation. So that is done. Otherwise one can go for the K-wire fixation. This is very important and I believe this is a very simple technique, one should do it regularly. So you take a big, actually K-wire should be around 3 mm, 2 to 5 out of big, no? And how we are going to push it? Yes, that is true. So this is going to, you must have a good space. Or devices out of machine. One. So this is it. So I suggest you to do so. I just suggest you to do so that during the procedure or techniques, you must stabilizing it and you do not have to have another assistant to do it. So one can pass a K-wire, you know the trajectory. So in AP view, you are taking the trajectory. So I am taking the trajectory like this. Okay, we are starting it. Oh, no? But it is not a model. Now you take a lateral view. So lateral view is supposed to go just beneath the anterior cortex, but you have a good space in between. So one technique is this. Another K-wire you can pass just below this. See, you can get another K-wire. Another K-wire you can pass like this. So these two K-wire, one in anterior cortex, one other is posterior cortex. Just enter. Trajectory you know that my direction is 1 or 133, whatever it might be. But lateral view have to be there just beneath the anterior cortex. Otherwise, if you are going too much deep or inside, it will be difficult for you to keep the not only Reaming, also all the technique. So this is one to stabilize. This will make you happy. ঠিক আছে রসুন you can do it or Now your stabilization is done with the help of your, suppose if it is done here. One, this. This is somehow you are making this temporary stabilization. What next? Out. Now where to put the incision?
Proximal.
Where to put the incision?
Around 3 to 5 centimeter incision, 5 centimeter proximal to the tip of GT.
He's right.
Yes.
In the axis. Now how you can calculate it in simple way? Mane simple way many times people used to do. You can draw a line from the intersuperior spine. Another tip from the line. So this is the axis. Cutting. What next is coming? Phasa. What phasa? Gluteus maximum phasa. Then you cut the phasa, then you split it. Split. Gluteus maximum phasa. Split the muscle. Once you are splitting, you are entering. Then one can have a feeling of the tip. This is very superficial. Many times you can have a feeling of this. The next job is to go for the what? Awel. So you put the awel in the where? Tip. Okay. Little bit of the nail. We'll talk about the nail, something of this nail. So, one thing, let us finish it. So, I am putting this in the tip. This is off axis or on axis?
Off axis.
Off axis. Because we are not in the same tract of the medullary cavity. So, it is always curved. So, we are starting it like this. Once you are in it, but before starting the point, I believe you should throw a lateral view also. Do not start on the basis of AP view. Many times you may be here. Many times you may be here, but AP view is saying that you are in right track. So, okay, keep it like this. Take a lateral view. Many times you may need to go down or up. So, on the thing is you have to be in the axis of the medullary cavity. That is the thing. That is why do not start penetrating into the bone until and unless you are getting confirmed with the lateral view also. Okay, sir? So once you are going, you can go inside. So it is good. Once it is, how long you have to go?
Up to LT, sir.
Up to LT. So in between you can have two shots. One on the starting, and later on also while progressing, many times you may progress like this, hitting the anterior cortex. Okay, sir?
Yes.
Or you may hit the posterior cortex. So trajectory should be like this, you are line in the abdomen. That is why in between one can take a shot to AP and lateral view also, so that I am in the right track. But once you are going deep below, if you are penetrating towards the anterior cortex, it will be very difficult to negotiate later on. So instead of going blindly, it is always preferred to go for any additional shot, no problem. While doing so, sometimes you will find a hard bone particularly. You will find and the owl tip is not very sharp. Owl tip is not very sharp and the bone is very hard. While you are pushing, you will find it may go slip down 1 or 2 millimeter above and down, sometimes this way. While penetrating, it happens sometimes because the sharpness is less, so it can slip. 1 or 2 degree slip will also lead to a lot of your differences. So that is always better to go for confirmation. There is no harm doing so. So that I am in the right track. That is done. So you are going like this. So once it is going, if this oil has a characteristic feature that one point see. There are two types of oil. One, you do not have this hole. Another, you have this hole. The hole I feel is better. Whole I feel is better in the sense that many times after moving you need to struggle a little bit to put the guide rail inside. It happens. It is frustrating one. I believe one should go for this sort of way. This is more easy. Once you are tracked, you put it the guide rail inside, so you can take it out. That is very easy. So once it is going in, so this guide rail is good. It is helpful so that you do not mistract it and also minimize the struggling period and you are always happy. So you are going inside. So it is paramount to see in between one X-ray, AP and lateral view also. Sometimes even it may go through the flexor line. Yes. The flexor line is here, you will find it is going out. So do not be overconfident. There is no harm taking a shot to look for the tip of the guide rail. Yes, sir, you will make it heavy. And so once it is going in, how much you are going in, you can take a mark on the cloth.
Yes, sir.
Why it is helpful? So while you are doing only maneuver, whether it is going up or going putting out from the track, you can confirm it. ठीक है sir? That is why you can give a mark and see that I am during procedure, I am not missing. Okay, fine. Acha. Next what?
Sir, reaming.
What reaming? Number 8. That is true. People are going reverse way also.
Proximal reaming, sir.
Reverse way also. What reverse way?
Proximal reaming.
Proximal. Okay. What is this size?
12. 14. Yes, sir.
He is right on. Almost 12. Everybody? 12. No.
14, sir.
What?
14.
14. Anybody?
14.
Everybody is wrong. So that is why you need to know for the little bit of your nail. Who is the other nail? Achha, you have various types of nail. And there are two types basically. One depending upon is short, another is long. Another is size.
Yes, sir.
Size is 8, 9, 10, 12, whatever might be. But what is fixed about here?
So proximal.
Tip. What tip? This part is fixed. So you look at the, this is important. Yeah? Let us call a little bit of the nail also. This size is fixed, irrespective of the size of the nail and length. To put it healthy. This size is fixed, irrespective of the length and the size of the nail. This is, what is the diameter?
12.
No. Is coming, tell me. Huh? Almost 16 or 17. 17 mm. ठीक है sir? He is right. Almost 17. So you know that there is an angle here. It is not a straight one. What is the angle? 6 degrees. This is 17. This is 6. And what about the holes?
So 135 degrees.
One is above, one is below. One is big, one is small. What is the size?
Yeah, so 6.4.
6.5.
6.4, sir. And taller to 8.
8 and 6.4.
8 and 6.4, sir.
Not exactly 8 actually. You say it is almost 12. This is 8.
Yes, sir.
In 12. I tell you. Now let us find out the screws also. Screw ki tarah khasne. This is, you can make up from the size also one can make out.
6.4.
One is
6.4, one is 8. 6.4.
oh. This is 12. This is almost 6.5. 8, no?
8.
Actually the size of it is 12. But anyway, this is 6.5. But that is not important. Important is that what is the rule of what?
Sir,
one is leg effect, sir. One is rotational effect.
sir, taller to leg screw है, ऊपर to derotation screw.
The most important screw is this one or this one?
Leg
This one. This is called hip screw. So actual load and fixation is done by these two screws, not by this screw. ठीक है sir? So this screw is a derotation screw. So that is important. So all the importance goes to this screw, a perfect stress. ठीक है sir? So what should be the difference between the two screws?
15 millimeter.
15. This is ideal. So if you are taking 90, then you minus it is 75 for the screw. ठीक है sir? That is one. Okay. We are now in the guide. Then nails again 17 mm. Angle is 6. Length is very good. 250. Again 240. Again you can have a length long and short. Difference between the long and short is that if you are going for the long, you have a right and left.
Yes, sir.
But if you are taking short, then the right left are almost same. So you can use. So that is different. So if you are going for the right side, then you have to because the curvature is not the same. Here the curvature design, you see the nail is not a straight one. There are two types of curvature. See, one is this curvature, there is an angle here already, 6 degree. Again, if you study nail is going like this, again curve like this. There is not here. This is taking the shape of the femur. So look at the nail is not a straight one, not like unlike the femoral nail. So there is one curvature already there, that is 6 degree. Again there is a bow like this and again curve like this. So this is not going to accommodate in other side. So right side will accommodate on right side, left side will be left side, otherwise you will struggle. So always have but in the armamentarium you must have all these nail available with you. Right, left, short, okay, you can do right and left both. So you want nail kothato, so the length and side, this is very good, but this is fixed. Angle is fixed. Holes are to fix. Only you have this, your length. These are fixed. Size is fixed, but length is variable. And ratio is 15. Mane if it is 90 hole 75. This is not very important. Important is this. Always the importance in it. This is going to give the actual support and stability. So once you are doing so, reaming. So how to start the reaming? People are going to here. So this reaming. This is proximal. Many times people used to start like this. So while doing starting, there is a device here, instrument here, which is going to prevent
Tissue
who is the tissue protector? So this is one. So I suggest you to actually we do not do it like this. All. So now you are doing. So why by doing so what benefit you are gaining? You are locking it here. You are getting, and you are protecting the muscle which is not going to be trapped by this. Yes. So always feel. So that is gluteus muscle is less damaged. So you go for this. Huh? Going. Fix. Okay. Then we are removing it. Now while removing, you look at the guide here. This part is. What next? What next? So next time you are going for the there are two types. So one is fixed, another is many times people used to go for flexible reamer. The flexible reamer is more easy to do, so one should take the help of the flexible reamer. Flexible reamer. So you know the shortening and thing that will determine what?
So endpoints.
That will determine the size of the nail. If you are going for 11, then what nail you are going to select? 10. If it is 12, then you are going to select 11. That is the principle is same. We do to be an out of human nailing, that when shortening is coming, that I have to limit there. This is the area, this is the size. So you know that this my size is there. This is the determination of size. So two things is done. One is reaming is done. Mainly cavity is still there, guideway is still there. We are doing the reaming, proximal reaming. Take the help of the principle. Make it a habit of doing so. Instead of dumping there, you will find these muscles are entrapped here, and you will do a lot of damage. To minimize the damage, better to eat a tissue protector. So it will minimize this damage of tissue protector unnecessary. Go inside, then start the reaming. Start the distal reaming with the help of your flexible reamer or whatever it might be. That will determine the size of the nail. So if you are going for a short nail, then you take the short nail. Determination of size is done. I did 11, so I will select 10. The mounting cord. Mounting. Now fix it. Cord lagao. Do it yourself. Do it as animal. You have to know how to do it. You do it. I am doing the right side.
ठीक है नहीं है
ना रुको टाइट है So, what next you supposed to do? What next you supposed to do?
To check the.
Correct. One thing, check it. Check it. Take the slips and check it. Yes. Also the distal locking. Check the distal locking. This reflects how much you are assisting and how much you are mindful to your own work. Do it yourself. ঠিক আছে এটাকে লগাচোন বাৰু নহ'ব ভাই সোমাইছে নে চাইছোঁ নাই ঠিক আছে একো নাই বাৰু একো নাই মই চাব লাগে স্লিপটো চাই গোয়িং স্লিপ এইটো গৈছে নে তাৰ ট্ৰেকটো গ'ল চ' দিছ ইজ ফৰ হেডি ষ্টেটিক এণ্ড দিছ ইজ ফৰ matching fine so this stitching should be done sometime feel like that. Now how to start? Karo, you do it. How to start? How to start? এইটো চা ইয়াতে মানে ইম্পৰ্টেণ্ট কথাটো আছে ইয়ৰ এটা টু মানে ওৱান থিং দেট ইউ ওৱান হেণ্ড চাটবে মেক ইট ষ্টেবল চ' দেৰ শুড নট বি মুভমেণ্ট লাইক দিছ এইটো যিটো হৈছে ইনিচিয়েলি ইট ইজ বেটাৰ টু ষ্টাৰ্ট লাইক দিছ go up to lesser together then turn it like this and rock not so one hand should to be to stabilize it that is important so there should not be movement like this you are stabilizing it and you are moving this one can hold it initially you start like this then go like this ঠিক আছে sir this is okay but there should not be in a tuckling otherwise it will be again difficult for you ঠিক আছে now where to place your place it ঠিক আছে now why you are man you supposed to come with the clean mindset see the track is like this the nail should be like this so this is the position so you must accommodate two screws there how to start এইটো লক কৰি লওক এইটো লগালো নহয় এইটো okay it is like this keep it like this now how to start how to start how to start
नीचे
মানে you put the skin incision there put it inside so one can take the help of one thing what how do you start it how to start it yes one thing you try to understand that one should see if the cortex is very thick see I will show the technique sleep very sleep how to start it okay fine this is okay fine This is going. I am in the outer cortex of the bone. So I take the help of this instrument to break the outer cortex. Sometimes if you are starting with the guide wire is very thin, so it will totally this way, it will not able to penetrate. And one thing is also true, then the rich country, they used to use the guide wire for the once only, they throw it away, do not use it. In our country we use it. So once you are using it, means your tip is becoming blunt. And once it is going in, it will, instead of going straight, it may go like this. And one time it will hit, but it may be center one. But since this your device is C, this tip is C, it is in the center. So it will going to hit the lateral cortex. So it is always easy to do. Sometimes 1 degree of C, there are two things here. What I am talking about C. See, once you are going inside, I may be like this sometimes. I may be like this, while if you are going through the guide wire. Yes, you may go like this way, but it may not be in the center. Once you are hitting the lateral cortex with this SAT center, so necessarily once you take this mate, this guide wire will go into the center. This is more ideal. Otherwise, it will be difficult for you to negotiate later on. This point is clear. So one there. So now what next? So I am putting this. The principles are remaining same for the both. So guide wire is passed. Once you are going to guide wire, one can have a mindset that my trajectory is like this, and I am going to put another guide wire in the next. Can I have enough space for it? People used to start with the inferior one, not the superior one first, inferior one. We used to start with the inferior one. We are starting it, okay, fine. From the inferior one can make out that from my neck is like this. How much space will we have? Two things. One, I am going too much near, down, or it can cut it.
Yes,
So after doing some operations, you can have a mindset that my guide wire is like this. So people used to pass the guide wire, then again withdraw it, again do it. Instead of doing so, you can have a trajectory. The mind axis is like this. If I am, or one can do one thing also.
Before this steps, the provisional K-wire should be removed or what?
Provisional case wire should be removed of what? No, you may not need to remove. You keep it like this. You do a fixation, then remove it. You are yet to fix the you are putting the nail, but yet to fix it proximal. So one can put it for the trajectory also. One can put a guide wire from here. যাও পৰা ভাই মই একো দিগদাৰি নাই এইটো ঠিক আছে. So from this guide wire, you can put another guide wire above it and look at the axis, then my bone head is enough to accommodate this screw or not. If I am not having this mass of here, one can go little bit of up and little bit down. So while doing the little bit of up and down, do not have the habit of hammering on this. This is a very unhealthy technique. One can withdraw it little bit of movement like this, you can. Or at all, if you say you take the device here,
Just sliding hammer and hit in the top tip.
but do not try to hammer it. This is a bad habit. Once you are doing it, little bit of angulation will lead to lot of your difficulties in the subsequent minute. So do not try to hammer on this part. This is a bad habit. I have seen people are doing it. This is a wrong thing you are doing. Always whatever you might be doing here, you have another device to lock it here, so that you can hammer it down, up or down, whatever it might be. So you can already another device you can apply. Then also this thing is clear. So then if this is done, then again we are putting another sleeve over here. Yes, again guide wire. So now reaming part. Reaming should be done with the two. So one can make out the difference between the two. One is small, one is big. Necessarily this is for the down one, this is for the big one. Which one is going to do first?
downwards.
What about the This is downward is the first.
First.
No, actually we are doing wrong. We supposed to study the first one.
Derotation, sir.
Derotation should be done first. ठीक है sir? So you do the reaming, then to put a screw. At length of the screw can be determined by two ways. One subtraction technique is there, where you can subtract it.
Guide wire of
Guide wire by. Another you can directly put the screw over there and do it. But usually it is better to go for the derotation first. Then while doing the tightening point it down again, this derotation screw will prevent rotation of the fragment, giving compression.
Yes.
Are you getting my logic is this? So if I am doing this tightening of this here, this screw is the main screw which is going to the hard bone and the good process, and while final tightening is there, it will try to rotate the fragment instead of compression.
Yes.
So to avoid this,
First.
two things. Now the guider roll is here. See the camera which I am putting, that is also somehow going to provide the stability. Yes, because this is also type to do a derotation type of thing. So it is not rotate. So fixation is there, fragment is there. If the fragment is, if your one is very tight one, ekdam tight, very tight, nicely finished, you are happy. But what additional thing you are doing? Instead of compressing, the fragment may get rotated. To avoid this, better to start this first. We will prevent rotation instead. And this screw will necessarily, see, it is counteracted, so it will give compression to fixation side. Got my logic? This is the science, and this is the thing we are going to do. We are doing the reverse thing sometimes. This is not the ideal one. Principle is this. ठीक है sir? This is thing. हो गल. It is now the screw and a trajectory from the fine reaming is there, and how much guide wire must go to the head?
Up to the subchondral bones.
Less than 10 millimeter. Do not go beyond that. And it is sometimes not logical to do a thorough reaming. Your in osteopathic bone. Because this screw is a self-cutting one. The tip, look at the tip. So it is going to give good process if you do not ream it. And this is more applicable for osteopathic. Got my point? So this is a very important thing. So particularly osteopathic one, while doing the reaming and I think you will know the bone is very soft. No need of doing so. This part is very cancellous and soft. May not need to do. Once 2/3 is already being done, 1/3 is left, you can leave. And final tightening will be giving a good process to the head, because this is self-cutting type of thing. Tip is there, you can self-cutting and going the good fixation. So these are the principles. One, we start from the derotation screw. The size is always fixed. Only length is variable. Ratio is to avoid jet effect. Ratio is 15. This will be done. Now other parts are simple. Then distal locking you have to go from this two types. One is your dynamic, one is your static. Static and dynamic. One can, depending upon you, can go for the both. Otherwise your closer and other techniques are there. Otherwise simple. Now any question? Any step? These are the basic steps.
So when to lose the traction, sir?
Why to lose the traction?
While giving the compression, sir.
See, so when doing traction, the put screw to come. You come here. Guide to find it. Guide to find it. Put the screw. It is sharp. It is, you want your tightening it sharp. You want to have a compression to fixation side. So now the compression will be done by the screw one. Another you can loosen it. So it is always his right to have a good contact between the fragments once you lose the traction now. So loosening of traction essentially help you compression one, and additionally it is also being compressed by the screw. Okay, sir? So that is the thing. So before giving the final tightening, once you loosen it, that will help you to approximations of the fragment. And this screw is also going to give a good compression. So that is the point. So that is why this is the ratio. Steps are clear and we are trying to adhere to these steps so that particularly for reaming part, taking protections from this soft tissue, then other steps, the first screw, second screw, tightening, length, other things are should be done this way. So that will be more better for the fixations and other technique also, simplification. Any question?
So ZF reverse it.
Reverse aspect you have to read. What happened here? What happened to the track? Is this sometime coming out, sometime going in? To avoid this, we do the ratio.
Keep distance.
Yes. To avoid this, we give the distance between these two. So you have to read certain thing. Z effect what? Sometimes the screw is pulling out. Or that happens particularly also with the bone process is not here.
Sir, evidence.
Done.